people don't feel hypertension. People don't know that they've got high blood pressure. And yet high blood pressure is one of the biggest causes of strokes, of having heart attacks, of kidney failure, of peripheral vascular disease, and of dying from cardiovascular disease. Every 10 millimeter increase in blood pressure, we're increasing our chances of stroke by 20%. A heart attack still can be treated, still person recovers from it and gets back to a normal life. But a stroke is far more debilitating. India is the capital of dying from heart disease, is the capital of high blood pressure, is the capital of diabetes.
Welcome to Season 2 of Health Charcha with Medtronic, the podcast where we simplify healthcare, share real-life experiences, and dive deep into breakthrough treatments. I'm your host Kartik, and today we are focusing on resistant hypertension, a condition that often hides in plain sight but carries serious risks, especially when it comes to stroke. Joining us today is Dr. Ashok Seth, Chairman, Fortis Escorts Heart Institute, a Padma Bhushan, a Padma Shri awardee, and a BC Roy National Award for an eminent medical person who has helped us unpack what resistant hypertension really is, and he's here to tell us why is it so alarming and how new treatments are changing patient care. Sir, you have done so much in life. There are so many things to learn from you. But today we are talking about a topic that has been neglected for so many years by our society and by a lot of people. Today we are talking about resistant hypertension, and I'm really curious to know your thoughts about it. You're the expert in the field.
Thank you, Kartik. Pleasure to be speaking to you. High blood pressure, can you believe, exists in 20 to 25% of our population. It's considered as a silent killer. People don't feel hypertension. People don't know that they've got high blood pressure. And yet high blood pressure is one of the biggest causes of strokes, of having heart attacks, of kidney failure, of peripheral vascular disease, and of dying from cardiovascular disease. Now, it's interesting that high blood pressure has grown by literally 100% over the last 15 to 20 years.
Absolutely.
Totally related to our lifestyles, stresses, etc., and many other factors. But the important aspect is that the public needs to understand that it is the biggest cause of all the killers that we have in our society, is the biggest cause of it. And we need to define, detect, and control it. That's what's high blood pressure all about. And then this resistant hypertension that you talked about is uncontrolled high blood pressure. Now, we may be able to diagnose high blood pressure if a person has a checkup, and then there are medicines to control that blood pressure. And every control of blood pressure matters in terms of prevention of strokes and heart attack.
Correct.
So that, can you believe that if the blood pressure is 10 millimeters up, what happens is that you increase your chances of stroke by 20%.
Okay.
Every 10 millimeter increase in blood pressure, we're increasing our chances of stroke by 20%. Chances of bleed in the brain by 30%. And that's why it's so important to control blood pressure with medications. But despite medications, there is literally 20 to 25% of high blood pressure patients who are not under control.
Correct.
And that could be resistant hypertension. So if blood pressure is not under control on 2 or 3 medications, we have a situation of resistant hypertension. By the way, if we have uncontrolled high blood pressure, despite medication, our chances of strokes from bleeds, etc., in the brain rise by 50%.
So we talk about stroke as being one of the most prominent factors whenever we talk about resistant hypertension. And it's one of those terms that are being thrown around on the crossroads, like throwing your visiting cards at this point of time. With the advent of technology, with how people are actually living their lives, lifestyle has a big role in it. And stroke being one of the most prominent factors. So can you shed some light upon this particular condition that is affiliated with resistant hypertension?
Yeah, I think it's associated with high blood pressure anyway, with hypertension anyway. But of course, resistant hypertension leads to far more increase in the chances of stroke, that's what I've said. So what is a stroke? Stroke is a very debilitating condition. Public understands stroke as a hemiplegia. A side of the body stops moving, speech. But what causes it is either a clot in the brain or a bleeding in the brain. And when that happens, obviously the brain stops functioning. The brain controls the whole body, right from our movements and our speech, our thought processes, to how we actually behave, conduct ourselves, to every aspect, be it our heart gets controlled by it and our every part gets controlled by it.
Correct.
And a damage to it is very debilitating. In fact, it actually makes a person incapacitated. There's a lot of social and economical problems that happen with it. It is something which stays with you for a long period of time, and it's not easy to get over.
Correct.
So, in fact, while we may talk about heart attacks as a very devastating event, a heart attack still can be treated. Still, person recovers from it and gets back to a normal life. But a stroke is far more debilitating in a lifetime. So I think we are very particular that patients get protected from strokes, even far more than we talk about other disease processes.
Well, sir, with stroke, there is one more thing that comes into the picture, that it's a sudden disability. There are families, there are patients who feel really overwhelmed when they get to know that they are suffering with resistant hypertension, and stroke being one of the most prominent factors.
Correct.
Can you explain one of those case studies that you have witnessed in your personal life and your professional life, where you have witnessed a patient's journey who is undergoing resistant hypertension and stroke?
Oh, that's happened to my own relative. It happened to my own relative, my aunt, who actually had high blood pressure for a long period of time. She would consult me very casually, as relatives do, because she was being treated locally in her own city. And I would always find her having a very high blood pressure and her being very casual about the fact that it was not under control. She would insist that it was under control, but whenever I casually checked it up during a visit to my aunt, I'd find it high and I'd be insisting. Till one day, and she would run a blood pressure 160, 170, anything between 150 to 160, she would be very casual about it. कि इतना तो हर एक का होता ही है age के हिसाब से. Till the day she actually came to me and she just collapsed and was brought into my hospital. Rushed from all the way from the distant city, and it was a bleed in the brain. And she was in a coma. Now, I had to save her life. She was in a coma with the bleed for the next 4 weeks, and gradually came into a situation where she became conscious, but never regained her senses of communication, of recognition, and was actually in a state which we call a vegetative state, where she was being fed by nasogastric tube, etc. And we supported her, and then she went home and was supported by home, but never in a situation where she could look after herself till she passed away 9 months later. In a way, a very sad story about exactly what I was telling her. And then all her family, all my cousins said that you told her so many times, I don't know what happened. We wish we could have stopped that. We wish we could have made her realize that high blood pressure, which was resistant, which was uncontrolled, should have been controlled. And that was a very, that's a personal, that's what happens to me when I now advise patients. I see my aunt's situation, what happened to her because of uncontrolled hypertension. And I even make that emphasis to my patients that don't take it casually. It's probably the most disabling condition. Uncontrolled high blood pressure is actually one of the strongest predictors of a most disabling condition, which is a bleed in the brain or a stroke.
So every time when we talk about blood pressure in general, whenever we are sitting out in our homes, whenever we are sitting out with our friends, family, or in a social circle, people often advise, because right now with the advent of technology, Google Baba is there. And obviously people go there, people Google stuff, and then they get to know that, oh, these are the signs and symptoms. Probably adding more pills, adding more tablets would solve the issue. But we have seen this in our personal lives, in our professional lives, in the society around us, that people who are still consuming medicines are still suffering with high blood pressure. So what are those new options that are available for all of those people who are suffering with high blood pressure, other than just adding more pills to their basket?
Right. I think it's a very important question. And whenever we have a situation of uncontrolled blood pressure, despite the fact there are 3 or 4 medications, or a situation where we believe that he's now going to be at a risk of a problem,
Correct.
there are a number of reasons for that. Firstly, is he actually compliant with the medication? Is he actually taking those pills, or is he taking it at the right time? Or maybe he's got other risk factors. Maybe he's overweight and taking too much of salt, which is another reason for uncontrolled high blood pressure. He could be actually, therefore, obstructive sleep apnea is another condition. We have other reasons for having high blood pressure, including obesity and everything. So we look at those factors. And if those factors do not exist, and there are other conditions and medical conditions which can cause raised blood pressure without having good control, really the answer is, beyond all this, can we do more? Can we do more for the patient? Sometimes adding more medicines beyond 3 or 4 doesn't necessarily get you the results. And the reason for that is non-compliance increases. The more drug, the more pills there are to take. The patient says, "मैं तो इतनी दवाई खाऊंगा क्यों कैसे? क्यों खाऊंगा?" They often miss their doses. So that's one aspect. And really, it's detrimental returns beyond a particular point with increasing medications. And therefore, options are there. Beyond these options, of course, are newer therapies where we are able to get control of blood pressure by affecting the nervous system which controls blood pressure. And then one of the newest therapies, and I would say it's not so new because it's been tested and around over the last 10 years, meticulously tested, is something called renal denervation.
Absolutely.
Renal denervation is a very fascinating, novel treatment of uncontrolled high blood pressure, or resistant hypertension, as we call it. And this is a straightforward, I would say, an angioplasty-like, minimally invasive technique performed in the cath lab, where we affect the nerves of the kidney arteries. You know, there are nerves in the which these are sympathetic nervous system in the arteries which supply the kidneys, which actually transmit impulses to the brain and all across the body to control blood pressure. And when we interrupt the sympathetic nervous system, or overdriven sympathetic nervous system, we're able to therefore control the blood pressure much better. In a technique which is 1 hour, done under local anesthesia and sedation with a discharge in 24 hours, we get a much better control of blood pressure. So I think we are moving in science forwards in saying, because every 10 millimeter control of blood pressure would decrease the stroke rate by 20 to 30%,
30%, yes.
It would decrease effect on the kidneys, would decrease effect on the heart, would decrease heart attacks. It's a huge step forward in saying those who got uncontrolled high blood pressure, despite all efforts, now have a treatment option which will make a control more effective and sustainable over a prolonged duration of time. Because through renal denervation, we've seen blood pressure control is not just happening for 2-3 months. The study is up to 9 years showing that through one single procedure, a better blood pressure control can be achieved.
Correct.
Over a prolonged period of many years. And I think science has therefore offered us that option for patients.
And when do you recommend this therapy to the patients? Because obviously it starts off with pills.
Yes.
Usually when people get detected that they have high blood pressure, whenever they go to their respective doctors or to the experts, they are given tablets. That we have seen that in our respective houses as well, whether it's our family, whether it's friends, whether it's our mom, dad, anyone. It starts with tablets. Then there are other more options that are available if you are really suffering with high blood pressure. When do you recommend RDN therapy to the patient?
It's a very important question. It's not a first-line therapy. That's got to be well understood.
Correct.
Drugs, medication are the most important first-line treatment. And you're absolutely right. That's what we would prescribe. That's what we prescribe to ourselves, to our patients, and we have a regime, we have an algorithm which we go through, which means patient has to be, if first we get them onto 3 drugs, and then the maximum tolerated doses of those drugs. We then also have lifestyle modifications to do, which is exercise, lose weight, all these drop blood pressure, cut down on alcohol intake. It's a very important aspect for high blood pressure. There are other conditions like obstructive sleep apnea. There are other conditions making sure that the kidney arteries are okay, that the kidney functions okay. There is your lifestyle, there's the low salt. Excess salt causes high blood pressure. All these factors, when taken into account, may help lower the blood pressure by 10 to 20 millimeters more than beyond the drugs. There's also the stresses of life, mental relaxation, yoga, all those increase. So we actually then start making sure that the lifestyle modifications are clear and complied with. Finally, we look at make sure that there are no other reasons for having uncontrolled blood pressure. And then when we realize that we're not getting anywhere and the patient continues to have high blood pressure despite all these efforts, is when we say, I think this is the time that we should intervene through this procedure so that we've given you enough time, we've investigated all aspects, we know we can't get you down below this point, and it may not be your fault, it may be just your body.
Correct.
And we therefore need to now move to this step of renal denervation, which will help us lower your blood pressure much more predictably and effectively so that we decrease your risk factors and your chances of complications effectively over a longer period of time.
Well, Dr. Seth, there are several myths that I really want you to debunk today, because we are talking about a condition that has been ignored by people for a lot of time. And people usually feel that this condition only affects older people. So there are few myths that I really want you to debunk. One of the myths is that resistant hypertension is equal to not taking your medicines properly. What's your take on that?
Not really. Yes, it may be one of the reasons for not being compliant or not taking them efficiently or not taking them on time. But there's obviously many other reasons. I've already alluded to some of them, which could be also high salt intake, excess alcohol, bad lifestyle, obesity, etc., and many other medical conditions. But it's also very important to understand that it is sometimes the body's own situation. That's the biological system. And every person's biological system is different. That's why we react differently to different medications. Responses are different. That's why we look different. And that's how we talk differently. So each of us is a different individual itself. And therefore, their biological systems, which also, despite the same number of medication, would have responses in someone else, may not have a response in an individual. That's why we've got to have alternative methodologies, additional methodologies, not alternative methodologies, additional methodologies beyond drugs and beyond lifestyle modification, certainly as a final option, which works and which will offer him, a better control of blood pressure. By the way, I just also wanted to mention, while we talk about renal denervation as a last option in the whole sequence of the algorithm we follow, there are some patients who say, "Mere ko to itni dawaiyan leni hi nahi hai. Why would I take all this? And anyway, I don't think I'm going to cut down on my lifestyle or change my lifestyle so effectively that I'll lower my blood pressure through everything you're saying. You may make my life hell for the next many years because आप कहते हो कि 4 दवाइयाँ भी खानी है, उसके बाद ये सब भी करो, उसके बाद I stop my alcohol and I stop everything and I stop. Maybe you should just do this treatment and at least I'll be on lesser medications and be better controlled and still continue to live a happy lifestyle." And yes, those are options, but those are options we do not want to offer to the patient. We want to tell him that you have these. Lifestyle is a very important aspect. It also takes care of a heart disease. It takes care of many other problems of the body. So we often say, listen, take this as the last option, but if you actually believe that it will get your blood pressure under better control, for us, that's a priority. And therefore, it is what we call an informed decision making. It's a teamwork where the patient and the doctor and the kidney specialist and maybe even the neurologist sit down together and say, listen, if you want to really now, you've had enough of this high blood pressure, you believe you can't get it down, you want to decrease the medication, okay, we offer you this therapy so that you have a better sustained control of blood pressure on lesser drugs. And then you lead the lifestyle that you want. Though we don't want you to do that. You want to lead a better lifestyle. But there are some, people have to have their own informed decision making around this.
Yes. Well, the second myth that I want you to debunk, doctor, is it's all about diet and exercise.
It's diet and exercise is very important. There's no question around that. But it's not all about diet and exercise. High blood pressure is also a process of the body due to many reasons. And it actually, therefore, is due to the blood vessels getting really, stiffer. It's to do with numerous aspects of kidney, arteries, kidney itself, the sympathetic nervous system. It is a multiple pathophysiology around high blood pressure. So diet and exercise is only a part of the lifestyle which may influence blood pressure by 10 to 15 millimeters.
Okay.
But the rest of it is an inner system of sympathetic drives and nerves, stiffness of the blood vessels, and therefore a whole conundrum which therefore creates resistant hypertension. And that's why we say, let's make sure that we treat it as a whole rather than just with one or two interventions, as we say.
The biggest myth right now in the society that high blood pressure is only for older people. It doesn't affect the young generation.
That's the biggest myth which exists. And I think it's a very important aspect because I don't want the youngsters to believe that they haven't got high blood pressure. In a survey in itself in India, can you believe that 30% of youngsters between age 20 to 50, and we call that young, had high blood pressure on a random survey of just a routine blood pressure check.
Okay.
Of course, a single blood pressure reading does not mean high blood pressure, but that's the sort of stresses and strains of life that our youth faces at the moment, that they develop this silent killer without knowing it. And therefore, it is not a disease process of the elderly. It goes all across the spectrum of all ages at the moment. And in the youth, at young age, we're seeing a rapid increase in high blood pressure, which is our biggest concern because that is why we're having an increase in heart disease in the youth as well.
Okay.
And therefore, we are very clear that the youth does need to get their blood pressure checked regularly. And if found high on at least 3 occasions, do need to consult a doctor, be on medications, and have it well controlled because for the youth, it's even more important. Someone who's 40 years of age has a lifetime of 50 and 60 years ahead. And were this blood pressure to be uncontrolled or resistant, he would be at increasing risk over the years of developing strokes, of developing heart disease, of developing kidney failures, because he's got 50 years of high blood pressure to face. So it's vital for the diagnosis of this young individual that they have high blood pressure, and then for control of that blood pressure so that we control the future of this young generation. We actually prevent them from having the problems that they could face. That's why this resistant hypertension issue is so important. That's why the uncontrolled hypertension issue is so important. It is an important aspect for our youth.
The final myth, doctor. Resistant hypertension, it's rare, but you don't need to worry.
It's not rare. Can you believe that of all the blood pressure CC, and as I said, 20 to 25% of our population, adult population has high blood pressure. And then we say, is this controlled? Can you believe that another 25% of the population that we have uncontrolled high blood pressure, have resistant hypertension? That is huge. Now, if you talk about 20 crores, what's 140 crores? If 20% of them is like 25 crores at least have high blood pressure, we're talking about adults.
Adults, yes.
20 crores have high blood pressure, out of which 4 crores are uncontrolled. 5 crores are uncontrolled. That's a huge population of uncontrolled high blood pressure there. So clearly, uncontrolled or resistant hypertension is a reality. It exists in massive numbers. And that is why we got to talk more about it, because it actually matters to patients, their lives, and prevention of strokes, heart attacks, and kidney disease. And we talk about everything from brain to the toes gets affected by high blood pressure. And there are at least 50 disease processes which happen through high blood pressure.
Well, doctor,
so it's a disabling condition, is what I would say. High blood pressure
Sure.
and uncontrolled high blood pressure, resistant hypertension, is absolutely one of the most disabling conditions that one can actually harbor, and therefore needs to be aware and have it treated.
Well, doctor, before we wrap up this podcast, one personal advice, one personal actually thing that I really want to ask you is a message for all our listeners, for all our audience members, one message that you really want to give to them, especially the younger generation. Because right now, people like me who have entered their 30s, people who have started up their work, people who have started their careers, a corporate world is a big world. And right now, people have stopped caring about how their lifestyle choices are. People have stopped caring about their health. People have stopped going outside their houses. People are constantly on their 7-inch or a 14-inch screen tablets.
Absolutely.
What is that one piece of advice that you really want to give out to all the youngsters of this country who think that all of these myths are the ones who are going to...
Yeah, a very good question. India is the capital of dying from heart disease, is the capital of high blood pressure, is the capital of diabetes. And we actually have the worst milieu for each of us to be affected. Therefore, our health is in our hands. And I want every youth to understand that. Lifestyle changes also is in our hands. Being informed exactly what we're discussing and talking about is also in our hands. Prevention is the key for all of us, especially our youth, because it concerns me that 50% of our population is youth. And have a long time ahead of them. And if we do not control these risk factors, then the future of the country, not just as an individual, the youth, but our country could be really dim in terms of health of the nation, which is very important. And therefore, if we talk about care, prevention is in our hands. Exercise, diet control, exactly understanding regular checkups, having simple checkups like a blood pressure checkup, like a sugar checkup, like a cholesterol checkup, which is really, and an echocardiogram, is a routine investigations which is easy, simple, and non-expensive.
Correct.
And knowing our risk factors is a non-expensive methodology of prevention. So I say to the youth, understand and know your risk factors. Make sure that you control them effectively. Be informed through discussion like this.
Absolutely.
Take your health in your hands and have a bright future ahead of you for many, many years if you do the right things.
Well, Dr. Say, thank you so much for sharing such valuable insights. And I hope the audience will take on those pieces of advice, like those words of wisdom. Like the tingle in their fingertips will surely help them make their lives a little better and avoid all of these conditions that can be fatal, that can be risk-worthy, not just for them, but for their families and for friends, because it can be really overwhelming if one gets to know that they are really suffering from a condition like resistant hypertension. So thank you so much for shedding
Kartik,
so
and I
much
also
light.
believe that everyone who hears this has a responsibility to spread this around.
Correct.
The knowledge of such interactions, but also not just high blood pressure, the knowledge of interactions around many aspects of coronary artery disease, heart attacks, all of them, which are all integrated together, is so important to spread around, because every individual should be much more knowledgeable and prevent problems for himself.
Well, thank you so much, Doctor, for sharing your valuable insights. Well, the takeaway is simple. Resistant hypertension is not just stubborn blood pressure. It's a dangerous condition that raises the risk of stroke and other serious illness. But with timely diagnosis, lifestyle changes, and new treatment options like renal denervation, patients have real hope for better control and healthier lives. That's all for today's episode of Health Charcha Season 2 with Medtronic. I'm your host Kartik, signing off. Until next time, stay informed, stay proactive, and take care of your health.